Dorothea Orem was a nursing theorist who believed in one powerful idea: people can take care of themselves, and nursing is needed when they cannot. This belief became known as the self-care deficit nursing theory. According to Orem, self-care includes all the activities a person performs to maintain life, health, and well-being. These activities may include eating, drinking, bathing, resting, and seeking medical care. When a person is unable to meet these needs on their own, a self-care deficit occurs. And this is where nursing begins. Orem's theory is made up of three related theories. The first is the theory of self-care. This explains why and how people care for themselves. Self-care is learned behavior and is influenced by age, health, culture, and lifestyle. The second is the theory of self-care deficit. This explains when nursing is needed. Nursing is required when a person's ability to perform self-care is less than what is required. The third is the theory of nursing systems. This explains how nurses help patients. Orem described three nursing systems. First, the wholly compensatory system. Here, the nurse provides total care because the patient cannot care for themselves at all. For example, a patient who is unconscious. Second, the partly compensatory system. In this system, both the nurse and the patient share responsibility for care. For example, a patient recovering from surgery. Third, the supportive-educative system. Here, the patient can perform self-care but needs guidance, support, or education. For example, a diabetic patient learning insulin administration. According to Orem, the role of the nurse is to assess self-care needs, identify self-care deficits, provide care, support, or education, promote patient independence. Orem viewed health as a state of physical, mental, and social well-being. Nursing, in her view, is an action taken to help individuals meet their self-care needs. Even today, Orem's theory is widely used in nursing education, clinical practice, patient teaching, rehabilitation, and community health nursing. Her theory reminds us that the goal of nursing is not just to care for patients, but to help them care for themselves.